My pleasure to welcome Sam Armstrong to our remote Reflections Dermatology in Action interview series. Welcome, Sam.
Thanks for having me. Great to be here.
So I just invite you to introduce yourself, including where you practice and how long you've been in your community.
Sure, yeah. So my name's Sam Armstrong. I'm a community dermatologist. I'm practicing in Charlottetown, Prince Edward Island, and I'm currently in my first year of practice in Charlottetown.
Amazing. So what factors led you to practice in your community instead of a more urban setting?
Yeah, it's a great question. I think professionally, I had a desire to practice the full breadth of dermatology and an interest in seeing all ranges of patient presentations. And also, I wanted to provide care to an area that was underserved. So that I found both of that here in Charlottetown. And personally, I grew up in a small town, and I appreciate the sense of community that comes along with being in a smaller place. So I think that led to my decision to be where I'm at now.
Yeah, it definitely seems to resonate with some people for sure more than others. But tell me, what is unique about working in your community compared to an urban center or compared to, where you trained? And how do these factors influence your patient care approach?
Sure. Yeah. I think this is true of practice anywhere, but I think the range in patient presentations and the acuity of patient presentations day to day is highly variable when you're practicing in a more rural setting, and if you're the only shop in town. And so I think that that gives wonderful variety to your day to day, but also brings challenges. And you may be working in a place that may not have a dermatology call service or an abundance of dermatologists to manage these more urgent cases. And so a little bit of creativity is needed to work those into your weekly schedule on the fly, depending on demand and need for those services.
Right. Yeah. So true. And so on the flip side of this, what is that? What is it that you find most rewarding about working in a community like yours?
Sure. Yeah. Well, I think if you're starting a practice in a place that's underserved, it's people are extremely grateful to have you in that community, and that is extremely rewarding. It's certainly a privilege to be able to offer effective treatments for people who may have suffered with a skin disease that's gone untreated for years, maybe even decades in some scenarios. So the fact that patients are so grateful to have a specialist in dermatology in their community makes the work very easy, and it's a joy to get up and go to work every day with that.
Love that. So obviously, with these sorts of practices, unique challenges arise. What are some of the challenges that you face in your community specifically?
Sure. Yeah, I think, depending on which community you're in, the demands for dermatology services is going to be different. Here in Prince Edward Island, our major industries are agriculture and fishing. And so there's a lot of occupational photo damage, and skin cancer rates are extremely high in our province. And we have the highest rate, along with Nova Scotia, I think the highest rates of melanoma per capita across the country.
Hmm.
So, and this demand, I think, is further burdened by high rates of inflammatory diseases like psoriasis. So a lot of dermatology services are needed here. And so the volume is one of the main challenges, and triaging consults appropriately and making sure those that need our services are seen as promptly as possible. I
Hmm.
think, and true across the country, it's probably magnified by primary care shortages, and a lot of patients maybe are being seen by online primary care services first, which I think can impact the quality of referrals and make it difficult to triage appropriately.
Yeah, very true. Very true. So in your community, how do you manage complex cases when they arise? What are your strategies?
Yeah, absolutely. With complex cases, I think the key for us is making sure you have enough time to deal with it and making sure you have enough resources around you to deal with the complex case and manage appropriately. I have a hospital-based clinic here that I have every second week, which really helps me in these types of cases. I can see inpatients easily as well while I'm in the hospital and collaborate with other specialties and services that are based in the hospital. So having great colleagues and other specialists that you're close with is a benefit of being in a smaller community and makes it easier to manage complex cases. And the other part of this is I'm lucky I have amazing dermatology colleagues within the maritime provinces, and we're not a huge geographic area, luckily. So they can lend their unique knowledge and expertise, and that's very helpful.
Did you train in the East Coast or did
I
you?
did. I
You
trained
did.
in class. Yeah.
Yeah, I do find that having trained geographically close to where you practice creates those long-term relationships that you can draw on, and you know, you've got the red phone on your desk when needed, and right.
It's
Yeah.
handy to have.
So what supports are lacking or do you think could be better developed where you work?
I think one thing that came to mind, though I'm relatively new to practice, I find taking time away from your practice of dermatology is very challenging. And I think that's true across the board, but maybe amplified in more rural settings or community practice where you may not have another colleague or an abundance of colleagues at least to deal with urgent matters that might arise while you're gone.
Mhm.
So that's one challenging area. And the other area I would say access to educational programming and CME programming. They're going to be less compared to if you're in an urban setting, especially associated with a residency training program. So
Mhm. Mhm.
having better access to those kinds of programs are great. It makes you feel connected to the dermatology community across Canada, and it keeps you up to date on our very rapidly changing landscape of therapeutics.
So true. What's your access to other subspecialists in your community?
It's pretty good. We have one or two of a lot of different
Mm.
specialists, and so the nice thing is you develop very close relationships with those people very quickly, and you know they're always willing to pick up the phone and help you if you need a hand. So that's been actually great.
Yeah, I like that. I like that as well. Looking to other colleagues who would, you know, potentially consider working in a geographic location like yours, what sort of incentives do you think draw people in, be it financial, educational, you know, professional, personal? What incentives do you think would draw people into working outside of urban centers?
Mm. Yeah, I think there's a few ways to go with that and a few potential effective ways to increase our dermatology specialists in more rural communities in Canada. I think one part of this is our residency training programs are and have to be in larger centers, but having opportunities for residents, especially later stage residents, to get out there and do rural placements is a great draw, and it allows the resident to explore opportunities and benefits that a rural setting might provide. And if you don't have experience in that, you may not think that you would enjoy that. So getting some experience in training could be really helpful there.
Hmm.
Uh, I think also dermatologists who are relocating to a more rural setting or community practice need to know that they're going to be supported if they have a challenging case that requires some help. And
Hmm.
so, medicine's a team sport across the board, and knowing you have a colleague somewhere that you can lean on and kind of pick their brain and get their expertise is comforting, especially
Hmm.
if you're starting out. And
Yeah.
yeah,
Those relationships are so critical, right? To manage
oh, absolutely.
complex
Yeah,
cases. You know,
yeah,
without them, you are really stuck. Yeah, so true.
yeah.
Switching gears a bit, what do you love most about your community? What really energizes you about living where you live?
No traffic. That's nice. Yeah, that helps. But no, it's in all serious, like our province is small but mighty, but the people are fantastic here, and they're immensely appreciative of all the important work we do as dermatologists. And so, I think that that makes getting up and going to work really fulfilling and really easy. So that's what
Yeah,
I've
that,
enjoyed
you're not the first person to mention traffic. It's funny how that finds high after you've been in an urban center.
across the board. Yeah, that's funny.
Five minutes to everywhere. So, what advice would you give to a dermatology resident who's considering working in a rural practice? Any advice?
Well, I think my first piece of advice would be to get out there and explore different communities and communities you might be interested in living potentially. And imagine yourself living in that setting and working in that setting and try it on and see how it goes. Residency is a great time to explore those kinds of options.
Hmm.
And um, I think, setting up a rotation with the dermatologist community setting is you can get a sense of their work, you can get a sense of their lifestyle. And I know I would, and lots of other dermatologists in these settings, I would be thrilled to have a colleague come and spend some time. So that's what I would,
100%.
yeah.
Nice. So, how could the CDA better support dermatologists who work in more remote areas? Any thoughts there?
Yeah, I think the CDA does a great job advocating on the behalf of dermatologists. And I think one piece I mentioned earlier is to continue to expand and promote the educational programming side of the CDA. And that helps build a bit of a community around people in more in community or rural practices. And so I think just expanding on that would be helpful. And then I think also we kind of mentioned through this is ensure rural dermatologists have collegial support for those complex cases, and maybe even a referral guide or know who to call if they're encountering a complex case that needs something that maybe they can't provide or at least want a second opinion on. And then I
We want a
guess,
series of red phones on our desks, right?
yeah, that's right, all the red phones. Finally, I mentioned taking time away from a practice can be extremely difficult in a rural setting, and everyone needs time away from their practice. So if we have a way to either promote locum opportunities for maybe there's dermatologists looking for those kinds of opportunities and connecting people in those settings, if someone needs or wants to take a leave of absence from their practice, that would be great.
That would be so nice. I know what you mean. It's really hard. I had 2 maternity leaves where I felt very, very difficult decision, to be away for that long. And I understand the conflict. Well, thank you so much, Sam, and congratulations on your practice. It sounds like you're really happy where you are, and Prince Edward Island, I'm sure, is very lucky to have you. So thank you so much for sharing your experience thus far. And, I really look forward to seeing how your practice grows and develops. Thank you.
Thank you. Appreciate it.